I think accountable care is part of the future of medicine. I don't know that anybody really has a sense as to what the future of medicine will be, but it clearly will take into consideration how a disparate group of delivery modalities comes together and solves the problems of a defined group of patients. And to that extent, I think it will be part of the future of medicine and can be applied to any financial model, even the fee-for-service model.
It will require a team to take care of a population because a doctor doesn't have the ability to go directly out from his or her office out to the community. It requires a whole infrastructure to do that. And an accountable care organization needs to have the capability of managing all those pieces and coordinating all those pieces for the health of the population.
Not only did the executive program give you the foundation you need to understand what an accountable care organization is, but it also strengthens the leadership skills that you may have or that you actually need to build in order to move change.
So I think one of the things that we examined thoroughly in this course, and probably it came a little bit in every session that we had, was how complex the healthcare system is, both across the country, but within the system that we're working in. And we actually examined that complexity in a granular way, looking at each part of the system, how the health plans are delivered, how populations are defined. And I think that in doing that, we began to understand all of the things that are needed for accountable care.
Participating in the course forced me for 3 full weeks to stay in a room, work side by side with people who came from totally different experiences, who were able to comment on problems that they faced and looking at solutions that were completely different from mine. And by so doing, they were able to suddenly, miraculously, open my horizon.
Change is really hard, and I work in a very large decentralized organization, which I think makes it even harder in many, many ways. And I think the value of the program was to really help provide tools to be able to manage change and to understand why is change hard for people and what are ways that we can really kind of move forward what we need to move forward. The courses around negotiation and leadership and change were really just terrific, and I think helped me feel much more comfortable in my ability to be able to manage change, and in my role as senior director to really kind of be a change agent for the health system.
The way that this program is structured is all of us are there together and trying to brainstorm as to how best organize all these different elements, because at the end of the day, we're caring for the same patients. At the end of the day, we are all sharing the same burden of expenses of being or trying to be fiscally responsible. So being together right there, organizing, sharing our thoughts, it really enhances the way I think about a patient nowadays. As a patient comes to see me, not only I consider myself more fiscally responsible, but I can think of some of the other issues that they have and they're dealing with, and I can also potentially begin to think of ways to solve those future problems. And I honestly do think that those are the kind of things that we as physicians, as healthcare providers, as nurses, as administrators, as anybody who's involved in healthcare, we need to pay attention to. And the only way that you do it is when you come together in this multidisciplinary group. So it really makes your brain think differently. And I know a little bit about the brain.